It is critical that you understand there are levels of care to treatment. The American Society of Addiction Medicine in 2011 came up with a definition for addiction, and if I use addiction, dependence, or substance use disorder, I'm using them interchangeably. But for the first time, they included not only behavioral manifestations of substance use disorder, but they talked about a spiritual component to it. And the component is that as you think about the illness of substance use disorder, a lot of people in the back of their head go, what do you mean an illness? It is my choice, or it is their choice if I opt to drink 12 of these at a sitting versus water. Well, one of the things that we talk about with the illness is recognizing on a very simple level the frontal area of your brain called the prefrontal cortex, PFC. Think of them as the babysitters, okay, or the parents. And then you have your limbic lobe, which is a little bit deeper in the seat of your brain near your brain stem. Those are the kids that'll run amok without the babysitter or the parents. And you have a number of hormones. You have dopamine, you have serotonin, you have norepinephrine. These are related to your adrenaline system. Glutamate, GABA, they're all kinds. And God made our brain so complex we probably haven't discovered the half of them. But nonetheless, all of these chemicals are reacting on your brain as well as different parts of your body. So what's happening is when you do anything that your brain is recognizing as pleasurable or desirable or stimulating, dopamine is one of the simplest ways to think of it as being activated. So when I shop, if I'm a person who loves to shop, my dopamine levels go up a certain amount. If I'm an overeater and pound cake is sitting there, my dopamine levels are going to go up a certain amount. If I'm just a hugger and I see my friend who I've not seen in 2 years and I hug them, my dopamine levels are going to go up, as well as other things like sex, etc. So think of it that when you have an illness that turns into a substance use disorder, the kids, okay, that limbic lobe, that thing that's responding to the emotions and the stimuli, it's reacting to all these normal things that we just talked about with a certain level of dopamine. When you add drugs that can be addictive, they increase and send that dopamine level much higher, at a higher intensity and at a faster rate than your basic things that would normally elevate your dopamine. So your brain at some point basically no longer is going to respond to, oh, I enjoyed talking to that person. That just isn't going to matter anymore because it's saying, give me that dopamine, give it to me as fast as I can, and I want it now. And I don't care how you get it. So that's how, when you just think of where we've talked on this platform, Lewis laying out under his sleeping bag and so many people, how did I get here? He got there, yes, of his own volition, but he also got there because at some point his brain is no longer his brain in terms of how it is going to respond. So when you are dealing with treatment, you want to talk about bringing a person into a level of treatment that first gets them out of harm's way. So you may have heard of medication-assisted treatment. You may have heard of Suboxone or methadone. But as you're looking at treatment, we have anything from detox. Detox is when you discover that someone in your family or your loved one or whoever you're trying to help needs help, and you get them into a detox program. That typically is a short-term program. They get on one of these medication-assisted treatments. I'll abbreviate MAT, medication-assisted treatment. And many people do that, and then they leave and they think that they're cured. Detox is not treatment. Detox is the very first step to just getting back to your brain being able to reason and be able to go to the very next step. So that first level of care is kind of to arrest the immediate danger. It is safer to put a person on a medication that has a longer half-life or action in your brain than the shorter acting opiates such as heroin or OxyContin. Part of the brain damage on this illness model that we talk about is that when you subject your brain to these increases and needs for these dopamine levels, the more peaks and valleys that you go through, that's where you can get repeated damage. And that's where you might hear the term, your brain is rewired. At that point, those prefrontal cortex, or those hormones that would act back and say, stop, you've had enough, to keep you from going on to becoming a dependent person or one with substance use disorder, it gets overridden, okay? So that's one thing I want to talk about is medication treatment. The other thing that we want to talk about is there are places that you can go. I will use Amethyst as an example, where people can come in and be in what's called a therapeutic environment. As long as you're in a structured therapeutic environment, you may not need medication-assisted treatment. Now, science and best outcomes and evidence-based treatment says give medication-assisted treatment. People have to combat what they may hear in air, in other treatment programs, or in their own brain, that I'm just substituting Suboxone for heroin. Well, the model of the disease is that this happens in many different illnesses. I really want you to grasp that notion of illness and not lock on so much to it's their fault, so I really shouldn't support it. It can be that it has to do with a moral failure. It can be that it has to do with the way you were raised, trauma, adverse events, but it also does have to do with no matter how you start, you are unable to stop. And that's where that lack of impulse control, that area that normally kicks in your brain and says, stop, I've had enough, that's where it's overridden. And that's where people can overdose fatally. The importance of treatment at younger ages. Between 17 and 26 years old, there was a study at the University of Michigan, but it was a good study anyway. And what they were able to find, that individuals who had the same high risk, so they had family history of substance use disorder, 36 of 57 of these individuals were considered to be high risk. They were high risk because they were given a number of exercises that they had to do, but they were unable to resist. They continued to be impulsive in whatever the exercise was. And then the remaining people were able to hold back, and they did not exceed the threshold for drinking or for marijuana. The threshold is very low. So again, Lewis talked about, we kind of will excuse, these are more my words, we'll kind of excuse our own sins. You know, if we did weed when we were young, or we had premarital sex when we were young, we kind of don't think of it as that much of a violation when our kids are doing it. But the bottom line, these are things that often are going to lead to a problem, whether you did it or not. You know, your dad's Oldsmobile isn't your Oldsmobile anymore. Do they even make Oldsmobiles anymore? Your dad's weed is not the weed today. And we don't have time to go into that, but it's much, much more potent. So one of the things you want to realize is that you do have to face the facts and realize that if once a week you drink 5 or more alcoholic drinks in one sitting, you are at risk for alcoholism and drug use dependence. If you use weed once a month under the age of 26, you are at a higher likelihood of becoming dependent on a drug. So there are a lot of stats that you can go into and learn how serious it is. The treatment, though, that you want to also look at, and reference again to the judge who talked about people think they're working a program and so they've succeeded, the treatment really focuses a lot on resilience, and that is looking at the risk and the protective elements. So people raised in the same environment, maybe even raised with parents that did do drugs, what is it that kept Susie from becoming a substance use disorder person, and Sally, who did become a drug addicted person? So some of the things that are thought to be protective are parental involvement, healthy peer involvement, availability of faith-based resources, after school activities, policies limiting the availability of alcohol, attachment, pro-social engagements, connectedness to adults outside of the family. So these are things that you want to start working with even adults, because addiction is not just a disease that affects you, it affects the next generation. The women that we have at Amethyst are being reparented, are learning parenting skills so that they can know how to deal with their children and maybe defeat some of these myths that they've grown up under. I want to leave you with just a few stats. When a person uses alcohol for the first time, there is a 23% chance that that person will become an alcoholic, and I'll use that term as an alcohol use disordered person. When a person uses opiates for the first time, heroin, there is about a 26% chance of that person becoming a heroin use disordered person. When a person uses marijuana, this is a stat from about 2009, that's the latest that I could find, it's only 9% chance that when they first use marijuana that they will become marijuana use disordered. Now that predates a lot of the lacing that we see with marijuana. The stat I want to leave with you though is cigarettes, nicotine. Nicotine is 36% from your first cigarette to becoming nicotine dependent. So why do I say that? We talk about legalization, whether it's marijuana, alcohol is legal, cigarettes are legal. Don't forget those drugs too. Opiates are critical, and we need to focus on that. That's what Grandview Talks or Talk Grandview is about. But remember again, the examples that we're leaving to those people that we're raising and that we're around with cigarettes, with alcohol, with marijuana, soon to be legal.